Type 2 diabetes is the form of diabetes you develop as an adult and is caused by a combination of genetic and lifestyle factors, including obesity. It used to be called adult onset diabetes, but the disturbing reality is that you can now find adolescents developing the condition. You'd think it was the bleeding obvious that the longer you have diabetes, the worse it is for you. But that, believe it or not, has not been pinned down by evidence. But a huge study, over 700,000 Australians, has come up with some answers. One of the researchers was Professor Jonathan Shaw, who heads the Clinical Diabetes and Epidemiology Lab at the Baker Heart and Diabetes Institute. And Jonathan is in our Melbourne studio. Welcome to the Health Report, Jonathan.
Good to be with you.
So isn't it the bleeding obvious? Why would you do this study? I mean, surely you kind of know this stuff.
Things that you think you surely know don't always turn out to be the case. And one of the things that's really been driving this has been the observation of, as you were referring to before, about these youth onset adolescents and sometimes even children with type 2 diabetes. And it does seem from looking at some of those populations that their outcomes are very much worse than we see in adult onset diabetes. But the numbers of those people tend to be rather small, and it's hard to do really definitive studies with small numbers of people. So what we did was we looked across really essentially the adult range and found exactly the same thing, that the younger you get your type 2 diabetes, the worse the outcomes are.
So you did this in, 750,000 people who are members who belong to the National Diabetes Services Scheme. That's where they get their needles and their test strips from the government, free from the government. So they're registered there and you can follow them. So to what extent, I mean, to how long and to what effect?
So what we see is we modelled it for every 5 years or for every 10 years of earlier onset of the disease. There's a measurable, so for every 10 years we saw a 40% increase in the risk of dying from cardiovascular disease at the same age. So a 55-year-old, for example, who's had diabetes for 15 years has a 40% higher risk in that year, a 40% higher risk of dying from cardiovascular disease than someone who developed diabetes 10 years later but is still of the same age. And so these are really important observations because it also gives us some information about the benefit of doing things even if all that you achieve is delay the onset of diabetes. People tend to think of, you're either going to get it or you're not going to get it. Can you do something to prevent diabetes ever occurring? Often we find that that's difficult, but this seems to indicate benefit even just for delaying the onset. So somebody who is at high risk of developing diabetes in their 30s or early 40s, it turns out it makes a difference if they can delay it by even 5 years.
And presumably it affects what's called the risk tools. There are risk tools where you can work out what your risk is of getting a heart attack or a stroke in the next 5 or 10 years. And that really asks a binary question. Do you have diabetes or don't you? Does this mean that the other question that's going to have to be asked in these algorithms is how long have you had diabetes? If yes, how long, and factoring that into your risk?
Yes, so there are some algorithms mainly used among people with diabetes that do factor that in, but you're absolutely right. But there's another component to this, which is that when we as doctors look after people in their 30s and 40s and we do these risk questionnaires for cardiovascular disease, they generally give us an answer in relation to what's going to happen in the next 5 or 10 years. Now, even somebody who is at high risk at the age of 30 or 35 is unlikely to suffer a heart attack or a stroke in the next 5 or 10 years, but they may be at very high risk of a premature event which might occur in their late 50s or early 60s. And at this stage, we don't have the tools really to calculate that kind of thing. And that's another thing that we want to do with some of this information, is to try and translate that into tools to measure the risk of premature events and premature mortality.
So one implication is if you can delay type 2 diabetes, and the Baker Institute's found that strength training, for example, can delay type 2 diabetes and lifestyle change, then that's a good thing. And the other thing, presumably, is to control your other coronary risk factors, get your blood pressure, your cholesterol down as low as it possibly can get, and certainly don't smoke.
Absolutely. And the other interesting part of this is that, again, as doctors, as we treat people in their 30s and 40s who have established type 2 diabetes, we're probably not as aggressive as we should be with those other cardiovascular risk factors, the blood pressure and the cholesterol, because we perceive that those events are far away and that younger people really don't want to have multiple medications. But one of the other messages of this is that we probably do need to treat more aggressively people with young onset type 2 diabetes.
Why did you showed, counterintuitively, you showed a reduced risk of dying from cancer?
Yes, so we have to be a little bit careful about that. So what we showed was...
Well, better be. I've been telling the world on the health report for years now that it increases your risk of cancer.
Yes, so you're 100% right about that. What we did show, what the data does show is that whilst for all groups of people with diabetes, the risk of cancer is increased, somewhat curiously, it appears that getting diabetes younger leads to a lesser increase than getting diabetes when you're older. Now, it's a little bit uncertain as to how to interpret that.
So does that mean you get a shock and you change your behaviour?
So that could be part of it. And it also could be, the other aspect of it could be that when you have a condition such as diabetes, you tend to get a whole set of blood tests, you get things done regularly, you're under the more careful review of doctors, and therefore cancers may be picked up rather earlier. And so in that sense, there may be some apparent benefits of an earlier diagnosis. But, you know, the real test of this is not individual disease mortality, but is total mortality. And we definitely saw the adverse effect of younger onset on total mortality. So there may have been a slight gain for cancer in relative terms, but the loss for heart attack and stroke, and in fact for death from neither cancer nor cardiovascular disease was also increased. So overall, it's definitely a bad thing to get diabetes when you're young. It means that anything that people can do to just push it off by a few years is beneficial, and that more aggressive treatment among younger people with type 2 diabetes is probably beneficial.
Got the message. Thank you, Jonathan.
Thank you.
Professor Jonathan Shaw, who heads the Clinical Diabetes and Epidemiology Lab at the Baker Heart and Diabetes Institute in Melbourne.